What's up, everyone? It's Dr. Jeff. Welcome to Ask Dr. Jeff, the interactive Zoom experience where we discuss all things photobiomodulation and Lifewave. I'm your host and facilitator, Dr. Jeffrey Hubbard, here in the Dallas-Fort Worth Metroplex. As always, excited to share space and discuss this revolutionary technology and how it's changing lives all around the world. We have some interesting topics today. I think you guys should get your pen and paper out and get ready to take some notes. I got some cool things to share with you. So first of all, let's just kind of give a little synopsis for those of us who are not quite familiar with Lifewave. This is a photobiomodulation or light therapy patch. You can see there right in the center of this patch is a fabric mesh. That fabric mesh is covered with a proprietary blend of organic materials. You can think of it as a liquid nanocrystal. Its job is to reflect certain near infrared frequencies of light back into the skin. That near infrared light actually comes from our body heat. So every day of the year, we are producing really powerful energies, right? That energy can be seen on the visual light spectrum, just not with the human eye. So we are capable of producing this light therapy, and we just haven't been using it. So essentially, this simplistically profound technology helps to repurpose that light, and by reflecting it back into the skin, which helps us to raise certain endogenous molecules. Endogenous meaning the body already produces it. This patch is simply enhancing or increasing the activity and the production of that particular molecule. In this particular instance, this is the X39, which is marketed. It's quite possibly our most important patch. It's definitely the most popular patch. It does so many different things. We'll get to that in a second. But it raises a molecule called GHK copper peptide, which has been studied since the early 1970s by a professor by the name of Laurent Picard. He's at Harvard. And he has isolated so many different things that this particular molecule does. This molecule is responsible for influencing 4,192 different genes to express their proteins differently, all of which are designed to help our bodies function more appropriately. So it's been coined the lifestyle molecule. Dr. Picard has been coined the turn back the clock doc. Really powerful information. He is still studying, still producing literature. Just as early as 2020, he published articles about the benefits of GHK copper peptide on the human body and how it works, right? So Lifewave has simply harnessed that technology, harnessed the study and the understanding of GHK and put it into a patch. Really, really powerful way to go about, ensuring that everybody can get access to this amazing technology and amazing science. And we have the really unique opportunity, guys, to be global distributors and brand ambassadors for this awesome company and awesome technology. Lifewave has been around since 2004. It is doing so many powerful things in the industry, more specifically now with stem cell activation. One of the things that happens when GHK copper peptide is elevated, you have an increase in natural production and activity of your stem cells. So for those of you who are not extremely familiar with stem cells, I mean, everybody's heard of stem cells, but what do? They actually circulate, guys, around your body looking for damaged, worn out, or otherwise compromised cells. And they're capable of replacing those cells with brand new ones, right? So those stem cells they morph, they change, they alter themselves to become lung, heart, bone, intestinal tissue, liver tissue, kidneys, skin, etc., wherever you're having an issue. So guys, the results are just simply phenomenal. Your sleep improves, your energy level improves, your cognitive function and memory processing improves. Many of our seniors provide us with awesome testimonials about how X39 improves your musculoskeletal issues, pain, issues with your joints, etc. And just your overall physical performance goes through the roof, guys. And then one of my favorite aspects is that it makes you look and feel young. It makes your skin more elastic, and it helps wounds to heal at a much higher rate than you would without the patch. So this is all clinically proven. There's over 90 clinical studies on these technologies, and it's patented globally. So, I mean, the science is unbelievably sound. I encourage everyone to go and take a look at the articles. On occasion, we cover those articles here on Ask Dr. Jeff. We kind of have been off on a tangent, focusing on different wellness strategies and practices and things that you can do in addition to the patches to be really diligent about your health. And guys, for the next couple of weeks, we're going to emphasize some different protocols that I have either found or developed or been provided in an effort to really address some key issues and some things that are going on in our society that I think the patches could be really beneficial for. All right. So that's what we're going to do today. We're going to talk about blood pressure, guys, and blood pressure irregularities. What can you do for that? There's actually a couple of strategies that have come from years and years of study with the patches. As I mentioned, Lifewave has been around since 2004, so it's 18 years old. And, Dr. Jeff has just been around for 2.5. So there's a lot of things to learn. I'm by no means an acupuncturist, but I am an enthusiast about how to leverage these patches, where to place them, how to place them, how long to wear them, and the orientation. So without further ado, let's jump into this blood pressure protocol. Guys, the reason I think this is so valuable is that, high blood pressure is a silent killer. Cardiovascular disease is always fighting with cancer and motor vehicle accidents and things like that as the #1 killer here in the United States of our citizens. So at the root of cardiovascular illness is erratic or abnormal, uncontrolled blood pressure. And we can get into a long discussion about why blood pressure might be out of whack or what you do to get to the root. But here are some things that, from my vantage point, can begin to address your blood pressure and your circulation to really make a significant difference, okay? So first, you need to get energy enhancer, all right? So here are the patches that you're gonna need. You're gonna need energy enhancer and you're gonna need Eon for day 1. And you're gonna need energy enhancer and glutathione for day 2, all right? So first things first is day 1. So guys, on the bottom of your feet, there is a acupuncture location or acupuncture point called kidney 1, all right? So I'm not gonna pull my foot out, but just follow me on this, okay? So on the bottom of your foot, so imagine if this is your foot, here's the ball of your foot. Just maybe a ½ inch or so behind the ball of your foot in the center is going to be a point called kidney 1. So imagine this is my foot, my toes are very long, okay? So here is kidney 1. So the most important takeaway is that energy enhancer and ice wave, they're a duality, they're magnetic, they have a positive and a negative patch, right? So you have to wear them either in symmetrical order, or you need to be very strategic to place on a yin and yang point. We won't get too deep into the acupuncture yin and yang stuff, just follow me, okay? So what you're gonna do is on your left foot, you're gonna put the tan energy enhancer patch, all right? On your right foot, you're going to put the white energy enhancer patch. That's just a general rule of thumb. Tan on the left, white on the right. All right. Say that again. Tan on the left, white on the right. So even if it's on one side of your body, you still want to have your tan patch to the left and your white patch to the right. I hope that's making sense. All right. So you're going to wear that orientation of the kidney 1 location with energy enhancer. Patch number 2 is Eon. Okay. Eon is going to go on the back of your neck at governing vessel 14. I think everyone recognizes that point. It's kind of the hallmark location to where all of your patches. It's a huge juncture for a bunch of meridians that are flowing chi through your body. All right. So that's right on the 7th cervical vertebrae on the back of your neck. Okay. Eon on governing vessel 14 on the back of the neck. All right. Thirdly, we're going to wear energy enhancer patches on the inside of your elbow. So make a muscle, and right at that point right there, if you push on there pretty good, it's probably going to be a little tender. All right. So, be considerate of the fact that you're going to bend your elbow throughout the day. Make sure you got a real good seal on your patch. Again, tan on the left, white on the right. I'm sorry, tan on the left, white on the right. All right. That's day 1. All right. And so from my understanding, and I've actually done it with myself, I had my blood pressure really wasn't that high when I took it the first time. So I didn't notice a significant change, maybe 3 or 4 points systolic, but that's still significant, right? 3 or 4 points systolic can take you from concerning pressures that are damaging your arteries to a healthier sort of circulation, all right? So, but you can take a pre-patch blood pressure and a post-patch blood pressure. That's the way to confirm that your body is appropriately responding to this particular protocol, all right? Day 2, again, you're gonna have energy enhancer, but in this situation, you're gonna have glutathione as your third patch. So you have Eon, glutathione, and an energy enhancer. Okay. So at this one, this is a new point we haven't talked about. There's a big muscle. I think you can kind of see it right there. It connects the back of your skull down to your collarbone. So it's called a sternocleidomastoid. All right. So behind there, right on the rear portion of that, about halfway up your neck, if you press on that, that's going to be kind of sensitive. That is small intestine 16, okay? And you want to patch on either side. You want to patch tan on the left, white on the right. All right, so again, we're going to have a symmetrical orientation for the energy enhancer. You're going to have Eon again on the back of the neck at governing vessel 14. And then on your right arm, again, you're going to make that muscle. And then you're going to find that junction right there. That is heart 3. All right. This particular point, you want to put glutathione. And again, make sure you're on the right side, glutathione. All right. So that is day 2. So from day 1, patching to taking the patches off, you should notice an improvement. And then even more significant improvement on day 2. All right. Guys, encourage you to have the proper minerals. Magnesium, copper, and zinc are going to help the patches work most effectively. I read some literature and books that say that every single one of us is magnesium deficient. We could hook an IV bag of magnesium up to us and go right into the IV and we still would be magnesium deficient. That is what scientists are saying about the lack of minerals in our food today, the lack of minerals in our soil. So you can always use appropriate mineralization. That's something that I want to really emphasize. And also, guys, you really need to drink water, okay? So here's a pro tip. Your water needs to be a good source of water. That's number 1. I don't have a recommendation per se, but you want to make sure that you get a healthy quality water. And you take a little pinch. I mean, guys, you shouldn't even taste it. Himalayan sea salt, the pink kind. Dash that into your water when you drink. All right. So try to get at least a dash in the morning and a dash in the evening. So that should go in about 8 ounces of water. Again, that healthy salt is chock filled with selenium, magnesium, and a lot of other minerals that you don't get in traditional salt. And it's going to help draw water into the tissue, into the areas that need it most. All right. So that is the conversation around blood pressure support, improving blood pressure, all of that good stuff. Caveat, probably want to ease into this, have a conversation with your doc, make sure that he's aware, she is aware of what you're going to be doing. If you take blood pressure medication, you want to make sure that you don't overdo it. All right. You don't want to shift from it being too high to it being too low. So that's why it's important. You guys need to have your blood pressure cuffs ready to go. Take your time with it and make sure that you're following the instructions properly. All right. This will be archived in YouTube. Guys, subscribe, send me messages, follow me on all the social media channels, especially YouTube, because you'll be able to see the archive of these videos. All right. Cool. Well, that is my discussion for the day. Hope that was edifying and you took something away from that. We're going to go ahead and get right into the question and answer period so that we have enough time to address all of your questions and your concerns. All right, so Anjali has already begun the party. She's raised her hand. You can go to the bottom of your screen and hit the reaction icon, and that will allow you to raise your hand. That way it'll be easy for me to locate you. Sometimes it's challenging answering questions and operating the controls and finding who's speaking and who has their hand raised. But if you do raise your hand, at least we'll have sequential order to answer the questions. And before we begin, Anjali, let's just, for the purposes of protecting the integrity of the company, we have to say that these amazing technologies, although they do wonderful things for the body, have not been approved by the Food and Drug Administration as a type 2 medical device. So these particular products from Lifewave do not heal, treat, cure, or prevent any medical condition. And although I'm a medical doctor, this is not medical advice. This is just educational and making recommendations based upon what I've read and studied about how these patches work. All right, guys. So Anjali, we're ready for you. You can go ahead and unmute yourself and ask your question.
Thank you. A couple of questions on your blood pressure protocol. On day 2, are you doing the 3 locations from day 1 plus the glutathione and you're adding another energy enhancer, or you're just on day 2, you're just doing the 1 pair of energy enhancer and glutathione?
That is correct. So you're just adding the glutathione on day 2, and you're taking away one of the pairs of energy enhancers. So you only have the energy enhancer here at small intestine 16. On either side, you'll have the Eon and you have the glutathione. On day 1, you have 2 pairs of energy enhancer. So you'll have them on the bottom of your feet, kidney 1, and you'll have them on the inside of your elbow here at heart 3. And then you'll have the Eon in the back at governing vessel 14.
Okay, great. And then on the pink salt, if you're using pink salt generally as your main source of salt throughout the day, is that good enough, or do you need to put it in water?
You know, if you're already getting a good ample amount, then I think you should be okay. I know a lot of people are suggested to use the DASH diet where you don't put a lot of salt, you don't use a lot of salt, but it's the quality and the grade of the salt that's really important. So Himalayan Celtic sea salt, that's a natural salt that is chock full of things that we need, not like iodized salt, which actually leaches the bone of a lot of important stuff.
And then I have a couple of other questions on some protocols that a customer asked me, but I can come back later and let somebody else go right now.
No, thank you.
Okay, no problem. And you could also email me too. That could work as well.
Okay, thank you.
No problem, no problem. Thanks for your question. Great to help to clarify that. I want to make sure everybody heard that because we kind of covered a few things that we haven't discussed before. So I'm glad we're kind of rolling through it to make sure that everybody understands exactly what's going on. All right. All right, Nancy, your turn. You can go ahead and unmute yourself and ask your question. You are next.
Oh, hi. I was just wondering what number your video is. Was last week 70 and that makes this week 71?
That's true. I did not introduce the episode. This is episode
Okay.
71.
Thank you.
And guys, I've been trying really diligently to put the gist of the meeting for each week in the title so that, you know, even though it says episode number so-and-so, that doesn't really provide a lot of clarity about what we're discussing. So, you know, I'll try to put something in there that will, you know, this one will probably be blood pressure protocol, blood pressure regulation support, something like that. So that way you'll be able to find it and understand what you're looking for. All right. Okay, guys. So there was a question in the chat about challenges achieving an erection and challenges with maybe maintaining an erection or having a completely full erection. So there's a lot of things to discuss there. The reality is that most of us who experience any erectile issues, there's an underlying or maybe not underlying cardiovascular issue. So one thing would be very good is X39 and X49. Both of those are going to really rev up your circulation, rev up your physical capability, rev up the opportunity to, you know, have appropriate blood flow to all the tissues. Secondly, EON would be really helpful as well. EON is a parasympathetic stimulator. It is producing neurotransmitters and hormones that are really active in the central nervous system and the autonomic nervous system. And that's what actually leads to an erection is parasympathetic nervous system activity. All right. So those would be my initial thoughts. Also, if there is any sort of circulatory issue in the penile region, like you just have atherosclerosis and plaque buildup in the arteries that is preventing you from achieving an erection, that's also that, you know, something that EON and glutathione could help. You could actually patch in the penile region, patch in the underwear. You could patch for healthy prostate function. So X39, glutathione, EON, those could go in your underwear. That has been proven to be very effective as well. Carnosine is great for cardiovascular function as well. That's a really good way to go about it. So those are my initial thoughts. If you have anything that's more specific, you can put another comment in the chat and or shoot me an email. So guys, here I'm going to put in the chat my email. This is specific for Lifewave related questions. And you can send me a note there and kind of maybe further articulate exactly what it is that you're trying to understand and what you can do. I guess next week, maybe I need to come up with a protocol for challenges with erection. Maybe I can come up with something like that specific. But to be honest with you, hypertension, like just elevated blood pressure, is one of the major things related to challenges with circulation and thus achieving an erection. So, this protocol we're discussing today could be very valuable for that particular individual. All right. Who else has a question? I don't see any more new hands. If you got something, you can just go ahead and unmute yourself. Deborah, did you have a question?
Oh.
Hi there.
Oh.
Hello, I have a question regarding the blood pressure protocol. It says day 1 and day 2. Is that protocol to be repeated? And if so, how frequently?
So specifically with energy enhancer, that patch is designed to remove blockages from the meridians. All right. So these are just common meridians that tend to get plugged and blocked and create, challenges with our blood pressure. So once you cleanse them, theoretically, you should have an improvement in blood pressure for an infinite amount of time if those particular meridians don't get blocked again. But perhaps there's something going on in your lifestyle, something going on in your day-to-day activities that is maybe contributing to the blockage of flow of energy through those meridians. So it really would be an individualized thing. Let's say, for instance, you use your blood pressure cuff, your sphygmomanometer, and you got a blood pressure, let's say, of 155/90. That's not ridiculously high, but it is higher than you might like it to be, right? It would be considered, if those particular types of readings would continue, then you would be potentially given a diagnosis of prolonged high blood pressure or hypertension. So you don't want those things to happen. What you want is to be able to kind of control and modify those peaks and valleys. So you would then, do that 2-day protocol. Hopefully that cleans the blockage from those particular meridians, and you're back down to some semblance of normalcy. Something around 125/80, 117/65, something in that range. That's a healthier blood pressure, especially for someone who's older. Okay. So I don't foresee this as something you would continually do. This would be something that you would do when you were specifically trying to get a reduction in what you consider to be an elevation in your blood pressure. Hope that made sense.
Yes, thank you.
Perfect. All right, guys, you're quiet this evening. Any other questions that we can cover?
I have a question.
Okay.
So what if you're on blood pressure medication?
So that's what I mentioned right when we concluded. I'm not sure if you heard that part. I said that it would be good to begin to have a conversation with your treating physician about what medicines you're taking. Obviously, with all of the patches, there is the potential for an improvement in your physiological function. So not just with this particular protocol, but with all of the patch wearing strategies, you need to be transparent, I think is the good word, with your treating physician if you're taking medicines for the particular thing that you want to improve. In that instance, you might need a reduction in your medicine or an adjustment in your medicine, maybe a different medicine. I'm a big proponent for natural strategies and holistic approaches to treating, what most people will consider to be chronic illnesses. Because usually if you can get to the root of the issue, you can begin to resolve it or solve it altogether. So that's really my objective for everyone, is to, be in better control of what's going on, and be able to have, an insightful discussion with your physician and say, hey, look, this is working. I'm noticing some reduction in my blood pressure, and I'd like to discuss potentially adjusting my medicines, and then you have that to begin to determine whether or not that's a smart strategy and what he or she feels like would be the best approach.
Dr. Jeff,
Yes, ma'am. Go ahead.
how do you approach a doctor who may not be open to holistic methods?
Well, here's my strategy, or what I would suggest for that. I would go into the discussion with some ammunition, with some weapons, right? Many of my peers and colleagues are very, very, very heavily educated, and sometimes it can be challenging for a patient or a client to introduce information that they haven't heard about. The sort of inclination is to think that, oh, this is not real because I haven't already heard about it or already been taught about it. So my suggestion would be to go and pluck a few of the articles from Lifewave related publications in science on our website under Research and Science tab, and to go into the discussion with the doctor or send an email and politely ask for them to review this article and let them know that you'd like to talk to them in more detail about their thoughts in regards to light therapy and photobiomodulation and how that can be addressed in your interaction with that particular doc. Now, with that being said, I don't want you to find yourself frustrated or bent out of shape if they don't respond appropriately. But that might be a hint that maybe you might want to consider finding somebody else who's more like-minded about what it is that you want to do for your health and what you want to do for your body.
Thank you.
So that would kind of be my strategy. But to be quite honest with you, most, if not all, doctors that see an improvement in the way that their patient's health is going, a different trajectory, they get very motivated and they want to know more. They want to find out more. I mean, there's been countless examples that I've been a part of where patients have started to really get better. And the only thing to attribute to their improvement is the utilization of the Lifewave technology. So, from people who have cognitive decline, I've seen, their doctors and neurologists become very enamored with the patches. We talked about cardiovascular circulation and blood pressure and heart health and those sorts of things. I've seen a lot of powerful recovery and things in that regard that doctors have really, had no choice but to raise an eyebrow about. A friend of mine, a friend of our family, their grandmother has some amputations, and they have been really aggressive with the patching, and it has dramatically improved her circulation, and she has not needed any more surgeries or any more amputations. And her podiatrist is bouncing off the wall because he's so excited that she doesn't have to go through that anymore. So there's countless things that you can utilize. Maybe send them a video that I've done. Perhaps somebody who has some credentials could sway their position on it. Perhaps, but I think those would be the initial strategies. And feel free to email me if there's something specific. Maybe there's a hang up. Maybe there's something that needs further explanation. Feel free to kind of give me a buzz, and hopefully I can point you in the right direction or provide some clarity that would help, kind of facilitate the discussion. All right. Any more questions?
I have one, if I may come back.
Sure, go right ahead.
Usually, thank you. I have a customer asking about pain, all over body pain from lupus, and what might be done, and I was thinking probably Eon and Energy Enhancer, but I have no idea what points I might use and if those are even the right patches.
Okay. So just want to make sure that we're addressing the pain issue and not lupus, right? So these patches are not designed to address lupus, just the symptoms, so
Right.
I would go in the direction of Icewave, actually. And we talked about the kidney one position. I have found that is a really powerful full body pain relief system. If you put them on the bottom of the feet, especially at night, it is really a dramatic experience in that same kidney one position. And let the magic happen. So tan on the left, white on the right, wear them symmetrically. If there's any particular area of pain, you can patch right on that with Eon or with X39. Pain associated with autoimmune issues tends to be all over the place and a case by case basis. So, just emphasize that they can, spot patch is what we call it. So if the knee is bothering them or hip is bothering them or back is bothering them, you can be aggressive in that respective location with X39, with Eon. And sometimes you wear those at night and then you wear the Icewave during the day, kind of to have a full spectrum coverage. All right. So you can use Icewave for breakthrough pain, but the reality is, when you have X39 and Eon going, that's a really powerful combination to begin to, address long-standing chronic pain issues, because it really gets to the root of the inflammation. It really gets to the root of why the pain is happening in the first place. Glutathione probably would also be a great choice, just simply because it's helping to eliminate a lot of the heavy metals and toxins. It helps your immune system to function better. It helps to, modulate the immune response and make sure that it's appropriate and not overdoing it, right? In an autoimmune related issue, your immune system is overdoing it. So you want to kind of tune it back or kind of, what's the right word? Just regroup. The cells need to regroup, right? There's a really complex communication system that happens between white blood cells and mast cells and NK killer cells and all of the different elements of the immune system. And if they're not communicating properly, that's when you have these sorts of autoimmune related issues. And so glutathione helps tremendously to kind of help them communicate better and have an appropriate immune response. So.
And would you use the glutathione on the points recommended in the booklet or some other spot?
I personally love liver 3, which is on the top of the right foot. You could start there. That's like a full body detoxification, or underneath the navel. I would be trying to hit meridians that had a really wide range of benefits versus getting real specific. So large intestine 4, which is right here in the webbing between the index and the ring finger, large intestine 4, underneath the navel, that's conception vessel 4. On the top of the right foot is liver 3. Those would probably be my top 3 choices for glutathione for general patching and full body effect of the glutathione patch.
Okay, and then the last question around that is, she apparently is on a lot of meds, so I'm afraid that's potentially going to interfere with the patches working. I've had that happen with other people.
Yeah, it's possible. Polypharmacy is a really big issue in our society. Pharmaceutical drugs have a lot of interactions with other parts of the body, which create side effects and other unwarranted or unwelcome things. And so you go in and you say, hey, I'm starting to feel this way. The doctor has begun to manage whatever issue they're prescribing that medicine for, and they want to just keep that where it is. So here's another medicine to deal with the side effect. And so over the course of time, depending upon how many health issues you have, you can find yourself taking quite a few different medications to kind of get to stability. So, what I recommend in that particular case is that you're just really diligent about understanding the medicines you're taking. Guys, you need to know what's going on and what to expect. So you need to know the mechanism of action of these drugs. What is it doing to your body? What are the studies saying? What are the side effects that most people experience, so that you can be aware that if something starts happening that you're not aware of, or that you weren't aware of may happen, that you can be able to relay that information to the person who's treating you with that particular medicine. One that really stimulates a good relationship between you and the doctor. I guarantee you that doctors like talking to people who are engaged and who are wanting to understand their health and wanting to understand the therapy that they're undergoing. And two, it just helps you to be more alert and aware of what's going on. So those are the things that I would convey to her. She needs to know that the patches don't have any particular interaction with the medicines. That's one of the great things about the patches. But there can be some changes that she needs to be aware of, like we kind of mentioned throughout this episode. For example, with blood pressure, if you're patching and you're using a particular protocol, or you've been using X39 for 8, 10 months, a year, you're going to start to see your body respond and rebuild itself and regenerate. And that in itself could begin to address certain things that you've experienced. And maybe you're not aware of it because it's happening at a snail's pace, but it's progressively and cumulatively making you healthier and better. So you might find yourself, why am I so tired? Why am I so sluggish? Why am I feeling like I'm kind of got brain fog? Well, perhaps you don't need as much of that blood pressure medicine anymore, because your blood pressure itself has begun to self-regulate by using some of the patches. So that would be your opportunity to go into your doctor and say, hey, look, I'm starting to feel lightheaded and sluggish. I'm wondering if I need to reduce my medicine. Can we have a conversation about that? Because some of the things that I've been supplementing with, some of the things that I've been doing from a natural supplemental health standpoint, they seem to be really working. And same thing like with thyroid issues. There was a lady who I had a conversation with, and she was saying that she had had thyroid issues for years, and all of a sudden she was all jittery and she was shaky and her hair was falling out and all of these sorts of things. And when she went into the doctor, she was now not low thyroid, but high thyroid. And it's because her thyroid had begun to heal, and she was still taking her thyroid medicine. So she needed to back down off her thyroid medicine. So guys, that would be my recommendation there. Drinks lots of water, make sure your mineral balance is good, and be consistent with the patches. If your consistency is big, if you are focused and you're wearing them and your body is getting used to the signal, it will respond on a schedule. It's just kind of like eating as well. If you eat at the right times and you eat on a consistent basis, your hormones are produced at the same times, your organs are working at the same time, and there's less chaos going on in your body.
How long should you wait once you start taking patches consistently? How long should you wait before you go and get blood work to see if your blood pressure med should be reduced or stopped? Should you wait 10 months to a year?
For some people, yes. I wouldn't say that you have to wait to get labs done, or wait to go and see your doctor for an evaluation, but you should definitely give it ample time to work. I say at least 90 to 120 days. to see. And you don't necessarily need to get labs done per se to determine whether or not you need a reduction in your medicines. Your symptoms or what's going on with your body response to should be sufficient.
Dr. Jeff?
Yes, ma'am. Go right ahead.
I'm sorry. I was just thinking, the people that are looking at their blood pressure, I mean, I personally have been taking blood pressure medicine for some time, and I get it free now because I'm 82 from my pharmacy. Isn't that amazing? But don't you think people should be monitoring their blood pressure with their own cuff? I mean, they're so cheap. They can even buy them for their wrist, and you know, they can take their own blood pressure, and then they don't have to go to the doctor to take a blood pressure because it wouldn't tell them anything really. I'm just saying a simple blood pressure check for themselves would be nice. That's a nurse.
Absolutely, 100%, Nancy. That's a great point. Is that really, guys? If you're taking a medicine or you've been been made aware that your blood pressure is out of whack, my challenge to you would be to keep a daily journal, a daily log of your blood pressure at least twice a day. If it's really bad, you need to check it 3 times a day. And the reason is not necessarily for you to know exactly what your blood pressure is to trend and track it. And you'll be surprised how engaged your treating doctor will be when he sees this log of blood pressures. And you can tell him, well, hey, on this day, and this day, I had these spikes, and I realized that I was very anxious, or I had a stressful day, or whatever the case may be. That is really valuable information for the doctor to be able to ascertain what the root cause of your changes in your blood pressure are. So that's a really great practice, guys. And thanks, Nancy, for that input. I think that it's extremely valuable to keep a journal.
Dr. Jeff.
Go right ahead.
I had a couple of questions. One is I've had a problem with my knee. There's been some discussion about whether or not it might be the meniscus.
Okay.
I did a pain patch back there, but I really didn't see any different because it's not hurting all the time. It initially was swelling quite a bit, and then it went down, and I can walk fine, but I don't have full mobility of it.
Okay.
And so I wondered, is there anything that might be able to help in the healing of what's going on in the back of my knee?
So it's in the back or it's internal?
It's in the back. I self-diagnosis of having loose ligaments, and I was getting up after a workout, and I heard something pop really loud.
Mm-hmm.
And I've had my legs roll out of alignment and so forth. That's been with me for a lot of my life. And so I got it straightened out, but it really swelled in that area. And so I used various things to be able to bring down the swelling and everything. But I'm wondering, in the healing process of, I can feel pain or soreness that comes up on the inside of my left knee. And but it's primarily in the back. I'm hyperflexive, so
Okay.
I don't have the flexibility like I used to in my left knee.
Okay. So there's a general protocol that we talked about, and again, you can find it. I can't remember what episode it is, but you'll see on there knees and joints or something like that. So take a look at that on the YouTube archive videos. But what I can say is that X39 is really just a powerful, powerful tool to begin to address underlying soft tissue injuries, underlying soft tissue instability, with the back, with the knees, with the hips, with the shoulders. It just works wonders. So I personally have a rotator cuff, a tender rotator cuff from baseball as a youth. And I know now it's much stronger, not quite as strong as my left shoulder, but definitely stronger. And I can really only attribute it to the X39. I wear all the patches, but I was specifically looking to see if there would be some improvement because I had considered what stem cell injections might be able to do for my shoulder and so on and so forth. So I think just patching on the back of the knee,
Okay.
I believe the point is called gallbladder 40, right? And so in the evenings, I would start at maybe like 8 or 9 after you wound down for the day, whenever that is for you. That's when I would apply that patch. Overnight is going to be a much more, from what I gather, is a much better protocol for joint related issues that need to be rebuilt, because when you're in your anabolic state overnight, resting and rebuilding, you want to have those stem cells actively working to rebuild those things. So that would be my strategy for that. And just give it time. I don't know how long you've been wearing your patches and exactly how you've been orienting them, but you might want to wear like a rotational strategy. Okay, here's what I mean by that. You put one on, let's say for instance, you start tonight, you put one patch on. Tomorrow, you're going to take that patch off after you've had your 12-hour dose. And then you'll wait until tomorrow evening to put your patch back on, right? And then that point, you'll take that same patch from yesterday and put it back on with a new patch. So you'll have a new patch and a half-used patch.
Okay.
So wearing 2 patches, but one will be from the day before, and you'll rotate them out. So they virtually have about 24 hours worth of life. So after the second day, you'll throw that patch away, but the patch you wore the day before will now be the patch that you're wearing as a secondary. So put both of those on the knee. You can put one on the front of the knee and one on the back of the knee if that's where you're having the challenge. Your meniscus is like your shock absorber in between your thigh bone and your shin bone. So that's internal. So you could put one, just below the kneecap or just above the kneecap. Both of those have been, really effective. Just below on either side of your knee, if you kind of dig in there a little bit, just below the kneecap, you have 2 soft spots. Those are called the eyes of the knee. So either one of those could be effective because there's no bone preventing the light therapy from going into the interior of the knee itself. So that's been the experience that I have had, either with Icewave or Energy, glutathione, Eon. All of those patches on the eyes of the knee can be very effective for dealing with acute inflammation, bone-on-bone rubbing, autoimmune issue inside the knee. But it sounds like yours is more structural and maybe a hint of damage or something like that from that popping incident. So I really would, if it's not painful and it's really not preventing you from getting around and doing what you need to do, I would stick with the X39 and just give it time.
So, okay. So because I wear X39 and X49 every day, in the back of the neck and below my navel. So when you're wearing X39 at night, which means you're going to be wearing it 24 hours a day, is it going to lose any kind of effectiveness or stop working or anything like that, even though you might have it on a different place on your body?
I would switch that. I wouldn't wear it in the day anymore. I would wear X49 during the day and X39 at night.
Okay. Okay. And then if you're trying to perk up a thyroid to a good functioning level, what would you recommend?
Glutathione right here at conception vessel 22. So just where your clavicle comes together, there's a little divot right there. I would patch right there. That's an amazing point for all things throat. I've seen a lot of people, that lady that I just mentioned, who had an improvement in her thyroid functioning when she went to see her endocrinologist. That's where she was placing. Now, she was also using X39 there as well. So you kind of got to pick one thing to focus on at a time. Maybe you emphasize the need for the next several months, start getting that feeling better, and then work on the thyroid.
Okay, thank you very much.
You're welcome. Marianne, did you have a question? I see your hand is up.
Yes, I do, Dr. Jeffrey. Thank you so much. My husband is a pastor, also a singer, has been for the last over 20 years. And he's having some real throat irritation where it's literally, it's affecting his vocal cords. And so what would be a good thing or a good patch that he could use that could help him in this area? He said his throat feels like raw. It feels very raw.
Okay. And it's just out of nowhere. This is sort of an acute
Yeah, I
situation.
just all of a sudden started in the last month.
Okay. So I think you need to take a day and a night approach. All right. So daytime, I would be really diligent with Eon and glutathione. All right. So again, utilize the same point. This is just like, I mean, all of this, any sort of issue with the larynx, with the pharynx, with swallowing, with thyroid, with, esophagus, anything in there, that point is really strong. So I would do glutathione and Eon. You can stack them. Sounds like it's inflammatory. So that's where I would start. And then you do X39 at night, same place. So
Okay, so same place, X39 at night, same place right there on your throat.
mhm. Yep. And I would give that, a couple of weeks, just see how he's feeling after a couple of weeks. I think the Eon and the glutathione is more of an acute approach. It will begin to address the inflammation and anything else that may be going on there that gives that sensation that it's like scratchy or rough. And then the X39 should help rebuild any tissue in that area that may be damaged or may be otherwise compromised. So you're kind of working on it both for long term and short term. So I think there should be some improvement fairly quickly if you kind of stick to that regimen. Also, there's a lot of things that people do, with hot teas and essential oils and black seed oil and different things to kind of help, stimulate, soothe that area. It kind of just passes through, but sometimes it helps it to kind of improve and feel better.
Okay, yeah, he's been using a tea that has honey and lemon and ginger in it. So he has been drinking that. But yeah, so
Sure.
we'll definitely try this because he has to have a voice because he's a preacher.
I know, that's important. So, another thing, guys, is that I think there is a really powerful spiritual component with these patches. So be on the lookout for spiritual awareness that comes with wearing these patches and how you should apply them and that sort of thing as well. And don't hesitate to pray over your patches when you apply them. And, again, stay hydrated and minerals and all of that good stuff. Every bit is important.
Okay, thank you so much. I really appreciate it, and we're definitely gonna try this. So, and prayer, yes, it's very important.
Perfect. And, we're here every Tuesday, so give us an update and let us know how things are going. We'll be expecting a great testimony of a miracle.
Yes, we definitely will keep you updated.
Okay, sounds good. Okay,
Nancy with another silly question.
okay, go ahead.
How do you keep a patch from declining in energy? Do you put the white paper back on the back of it and then hide it under a piece of paper or something? I mean, how do you keep it from blowing out into the air if you're
So
going to use it a second night?
it's only stimulated by your body heat. So as long as the patch is away from your skin, away from 2 inches, you don't want to put patches in your pocket or in your bag or something like that, because if they're in close proximity and that body heat gets in within a couple of inches of them, you will start to drain them. But they're like batteries. So as long as
Okay.
you take them out, like take them out of the remote, put them in a safe spot, they'll last for however long, for instance, this one has an expiration date of June 2023. And I've had these patches for a while. I bought a big
Okay.
so, they've got a long life. So, I mean, you can put the reason that you would put the backing, on them after taking it off is because you wanted to preserve the adhesive. So that's really what happens to me more often than not, is that the adhesive begins to decline and it just won't stay where I want it to be. So in those instances, I'll throw it away. Like, I sleep maybe 5 or 6 hours a night, right? So theoretically, my Eon and Aloe Vita combination that I wear here on my forehead should last for 4 nights. So sometimes on the 4th night, the adhesive is not really strong enough to stay there. So I have to, determine how I want to do that. So sometimes I can, stick it and seal it real good, or I have to, really scrub and clean my face and make sure it's dry so that it affixes well. I have put tape, I have put Band-Aid, just to get that last night out of it. Rolling around on the pillow, sometimes it'll come off. So there's that. But in general, you can put it on your nightstand and turn it upside down. You can put it on wax paper. That's really good. You can put it on cellophane. That's really good. Sometimes if you put it on glass, even if you put the adhesive part onto the glass or onto the wax paper, you still can pull it off without, really diminishing the integrity of the adhesive.
Okay, so it's body heat, not 90-degree Florida weather.
Correct. Now, you don't want to have your patches in direct sunlight. You don't want to leave them in the car. You don't want to leave them in the trunk,
Okay.
but having them in your room in a climate controlled environment is not going to diminish the patch.
Yeah, and I picked up a couple of Faraday patches or containers from Amazon too. So you can put a whole package of X49 or X39 in those Faraday patches, or I'm sorry, pouches. So, okay, I'm done. Thank you so much.
That's a good point. I'm sure there were some people who gained some good stuff from your question.
Yeah, it sounds like simple questions, but I'm sure everybody's got that in the back of the head. Well, I wonder if, yeah.
Right, exactly.
Okay.
Exactly.
Good night.
Good night. All right, Bill, take us home, man. Last one.
So I've been on the patch for about 8 months, and I've been frustrated that I can't get 8 hours of sleep. After about 6 hours, I'm ready to get up. So that's okay, huh?
That's pretty good, man. That's pretty good. To me, if you can get what you need out of it in the time frame that you got, there's no point in sleeping in. You're about ready to bounce up and get the day started. So that's a good thing. How are your sinuses doing?
Very, very good. Wearing the patch up here, for me, reduces the congestion and reduces the amount of mucus flow that I've had over the years. I'm just a happy camper. It's great.
That's really awesome, man. I've got a buddy of mine, and he's been suffering with allergies and sinus stuff for years. And I keep telling him, like, hey, man, just do this, and he doesn't believe me. So I'm going to send him this video and tell him specifically to go to this particular time point and listen to you, because
You haven't called me.
I shall. That'll be good, man. Absolutely. Well, hey guys, this has been an awesome discussion as per usual. I'm so excited every Tuesday to share space with you all. Like and subscribe to my YouTube channel. Guys, again, we're trying to rev up the amount of view time and my subscribers and my likes. Guys, we're almost done with Ask Dr. Jeff. We're going to be launching that just in the next couple of days. I've been in the laboratory trying to figure out the best way to get everything ready to go. So stay tuned for that. Everybody who's on my database will get that information. Okay, asking for the email again. Hold on, we'll put that here in the chat. If you guys want to be added to the database, just shoot me an email and say, hey, Dr. Jeff, I want to be added to the database. That way I can keep you informed of all of the stuff that's going on. Guys, Patches and Prayers is really revving up. We've got a lot of cool things planned. As I mentioned before, I'm going to be traveling to the Philippines the last week in July. So I'll be there for a couple of weeks. If you got any contacts in the Philippines, if you got any contacts in Indonesia, if you got any contacts in that Southeast, Southern Pacific area of the world, please let them know that I'll be there live in person, and we'll be conducting several events around the archipelago of the Philippines. So looking forward. It's going to be my first trip to the Philippines, so I'm really excited about that. And also about the promotion of Patches and Prayers. We're specifically targeting the healthcare market in the Philippines, where we want to connect with doctors and nurses and healthcare administrators to be able to help them to understand how powerful this technology could be for their respective discipline and for their practice. And we're also looking for individuals who want to become wellness representatives for us and kind of act as our liaison between the technology and Lifewave and the doctors who are really extremely busy and have a lot of responsibilities and need some support, all right? So we are open to having individuals here in the US be those wellness reps as well. So again, if you're interested in that at all, contact me and let me know. We have a huge database of doctors. I recently have increased my LinkedIn presence to promote in the Philippines. So we've got like 300 new contacts of doctors and nurses and chiropractors and dentists and various different individuals in healthcare in the Philippines. So we're really revving up for this trip, and we think it's going to be an amazing opportunity to really introduce Lifewave in its fullest there in the South Pacific, specifically in the Philippines. So excited about that. And finally, guys, just want to thank you for all your support. I greatly appreciate all of those of you who are consistently coming to the meetings and asking great questions and really leveraging this amazing technology to improve the health of yourself and your loved ones and those in your circle of influence. I greatly appreciate it. Enjoy sharing space, and I'll see you guys next Tuesday, okay? Have a great, great week and a great Tuesday.
Thank you, Dr. Jeff.
Guys, see you later.